Did you know that this year, 161,360 men in the United States will be diagnosed with prostate cancer, and every 20 minutes, another man will die from prostate cancer? Now, since this is Prostate Cancer Awareness Month, it is perfect for us to highlight the myRisk Hereditary Cancer test. Dr. Neil Mariados is here to tell us more about this genetics testing. Doctor, thank you so much for being with us.
Thank you, and it's good to be here.
With those statistics, and like I said, this being Awareness Month, this is a great time for us to kind of get this information out. Can you tell us more about this test?
So this is a breakthrough test that has been used in other types of cancers, such as breast and ovarian, and now is used in the prostate cancer space. But it essentially detects men with the prostate cancer who have a mutation. And these men tend to behave differently. When they have this mutation, they are 6 times more likely to die of their prostate cancer within 5 years compared to a man who does not have this disease. These men usually have more aggressive cancers, and they usually have more advanced cancers. That means it's spread to the lymph nodes or to the bone. But it also alerts the physicians and the patient that they may be at an increased risk of having other types of cancers in their body, such as breast cancer, colon cancer, melanoma, to name a few. And because they have this mutation, they could have 50% of the time pass this mutation down to their children, or their brothers or sisters could have this mutation, and then we can activate certain measures and precautions and screening to protect those family members as well.
And with this information that we're gaining from this test, does it also kind of guide the treatment options?
Well, you know, it does. And because these men who have this mutation detected by this test, they act differently. So they're usually more aggressive and more advanced, and they are usually more sensitive to a certain type of chemotherapy, platinum-based chemotherapy, and they are showing that they are also responsive to a generation of medications called the PARP inhibitors. So those measures can be used earlier to help protect these men.
And I know we're talking about some of these treatment options that are available. Are there also some side effects that are coming along with these treatment options?
Yes, you know, men who present with this with prostate cancer have different types of risks. So, in men who have intermediate risk or advanced prostate cancer, they could have surgery or radiation or hormonal treatment or chemotherapy. And right now, you know, there's no precision medicine for these men as far as tailoring their treatment to their aggressiveness of their disease from a genetic standpoint. So this is a first step in the right direction of maybe tailoring their treatment.
You know, and Doctor, at the very beginning, when I was kind of giving those numbers, they were very shocking. And I'm sure you get this question quite often, which is, with all these advancements we're talking about, why is it that, you know, that stat that I threw out, every 20 minutes a man is dying from prostate cancer, why is this still such a shocking number?
Well, you know, just like you said, it was a shocking number when you read it. So, but this is the advantage of making the people more aware that prostate cancer is not at all times an indolent type of disease where many people think that, okay, I have prostate cancer, don't worry about it. There are many men that die of this prostate cancer, and we may need to take active measures, such as seeing if you are at risk or at increased risk by doing this test, by getting your PSA, by seeing your physician, by being vigilant about getting your screenings to manage this disease and hopefully prevent it from happening.
Well, Doctor, thank you so much for doing your part, talking to me to get the information out, to get that education out, and we're going to definitely try to hopefully combat that number. Doctor, thank you so much again.
Thank you very much.
Don't go anywhere. The Morning Blend, we'll be right back.